Today's date is April 20th, or as many call it, 420, pot smokers, if you will, a day where recreational medicinal marijuana users across the globe are showing their appreciation for weed.
But for those opposed, they might argue the legal cannabis industry downplays the negative health impacts of marijuana use. But organizations such as Smart Approaches to Marijuana, or SAM, are now sounding the alarm over the growing health risks apparently associated with the drug. Dr. Drew Pinsky is a board-certified physician and addiction medicine specialist. Paulina Pinsky is a recovering addict. And Dr. Kevin Sabet is the president and CEO of SAM, as well as a former Obama administration drug policy advisor. And Joe Pinion is here with us back on set. So welcome, everyone, and thank you so much for coming on this 420. For those, clearly there are folks out there who participate. It is legal in many states, and some use it for medicinal purposes or even in place of alcohol. To relax. But Dr. Drew, let me start with you. I understand you've got some concerns about potentially the negative impacts of frequent marijuana use. Is that the case, especially for those young folks? Tell us what you found.
The primary issues are the interruption of development of the brain. Psychotic episodes are on the rise dramatically. Addiction is on the rise dramatically, really because of the extraordinary concentration. It's a different drug now. It's a completely different phenomenon. And as a result, we're seeing entirely different clinical syndromes. We're seeing anticholinergic deliriums in people over the age of 60. ER visits for hyperemesis are frequent. And I feel that people learn about the reality of these things from cases. And I have a case in my own family, and I brought her along with me. So, Paulina, maybe you want to mention what your history is with this.
Yes. Hi, I'm Paulina, and I'm a marijuana addict. I'm 485 days sober today. Tomorrow, or 2 days from now, I'll be 16 months sober. So I am a mere toddler in recovery. But I am someone celebrating 420 by not partaking.
What would you tell people to say, oh, you're Drew's daughter? That's your recovery. Believe me, she would not want to hear from me.
Against it for a long time. Even though I grew up hearing someone in the house saying that your brain stops developing when you start using. I didn't start drinking until I was 18, which was super late, but I still came to the game fast and hard. I didn't smoke for the first time until I was 22. However, I made up for lost time. I am now retired after a 5-year chronic marijuana use. A chronic user is anyone who smokes up to or more than 2 times a week. I didn't know anyone, and still don't really know anyone, who is an active smoker who smokes 2 times a week. I myself was a daily smoker from the beginning. In the beginning, I loved it. It was so much fun. But inevitably, as all addictions are, it's progressive. Marijuana, it can be addictive, and I know that because I experienced it myself. The consequences are coming because I experienced them myself, and I know what it is like firsthand. In this last year alone, I have seen 4 different cases of weed-induced psychosis. It's dangerous that the idea that weed-induced psychosis isn't real. It is very real. I've seen 4 different cases of people in my close proximity go through weed-induced psychosis. I'm lucky I never got psychotic. Though I did, summer 2018, I had a hypomanic response, and my weed use was never questioned. I was just put on more psychiatric medication.
Can I jump in really quickly? I don't mean to interrupt because we're so limited with time, and I'm sure a lot of viewers want to know, but there's this common understanding that marijuana is not addictive. How do you respond to that? Either one of you.
Yeah, well, look at the science. I mean, and the reason the common understanding is there is because there's a massive for-profit industry driven by big tobacco and big alcohol. They're both highly invested in marijuana, whose, the name of the game for them is profit. So they're putting out messages that are false, including messages that, well, people are using it instead of alcohol. Actually, in every place that it's been legalized, alcohol use is going up among that population. It's co-use. It's not one or the other.
And they're creating more addictive properties. The higher concentration, more addictive. It was kind of unusual, not unusual now.
It's also not replacing opioid use, right? In the places where marijuana has been legalized, there are more opioid overdoses and deaths.
That's right. But there's this massive industry pushing lies, and we're going to continue to push back on them.
And to them, I say I could not stop smoking even when I vomited every day after every bong rip, right? That is not normal behavior. That is not non-addictive behavior. I could not stop until I hit rock bottom. And I think I'm a testament to the fact that I could not stop smoking until it got really bad. And now I can.
Well, and that's wonderful. And Paulina, clearly you've got, the support of your father, and I'm sure a wide support group to get you through it. Could you sort of explain what got you to this point, the recovery phase?
Definitely. So my rock bottom, I was trapped in a car with someone in weed-induced psychosis for 3 days while driving from New York to New Orleans. I had a panic attack outside of an Alabama gas station, and that was my first moment of clarity. In that moment, I didn't realize that I was walking towards sobriety. That was not what I intended, but thankfully I was able to crash land at home. And having my dad be who he is, he suggested that I go towards 12-step recovery groups. And since then, I have been going to meetings daily. And I think, there is a spiritual element to recovery, but also the non-abstinence is just the beginning.
And it's a medical condition with a medical treatment. It's now well-established, evidence-based, that 12-step is as effective as any other professionally managed therapeutics, and it is free. And it's available now to anyone who's struggling.
But it's hard because the messages we're hearing from the media and the industry is that it's not addictive, it's harmless. But as Drew was saying, this is not the Woodstock weed of the past. We're talking 99% concentrated vapes. We're talking the shatter, which doesn't look like marijuana at all.
Highly concentrated THC, which you use with a flame torch.
Right.
And the first time I did a dab, I felt my soul leave my body, and then I projectile vomited onto the couch and the dog, and then I shook in a bathtub for 3 hours, and that was just my first time using it.
And we think we can turn this around. We turned around smoking. We had smoking sections in restaurants not long ago. We had smoking sections in airplanes. We used to tell people to drink one last drink for the road. These are behaviors that sometimes as Americans we need to learn the hard way before reversing. But we have people like Cory Booker now admitting to marijuana being a problem. This president does not agree with legalization. Multiple states have rejected it in the last couple of months. So we think we can turn this around.
And we are not here talking about putting people in
prison,
in prisons or jail or anything. We want people to get care and treatment for this medical problem.
Yeah, but of course, this industry is targeting Black and brown communities, as they did with alcohol and tobacco, with menthol cigarettes, by targeting the most vulnerable communities. And that's why there are, 8 times as many pot shops in poorer communities of color in this country than in upper class communities. This is a regressive policy.
Yeah.
It's certainly progressive, and we're going to be talking about that too.
Well, we appreciate you coming on. We ran out of time, so Joe, sorry I didn't get your opinion on the matter. Did you have 5 seconds to?
It's not your mom and dad's dope. Things
That's
have
right.
changed. We have to make sure that we're not repeating the mistakes of yesterday, from the cigarettes to the alcohol. We know much more today than we did back then, and I think the same can be said about marijuana.
That is Dr. Drew Pinsky, Paulina Pinsky, Dr. Kevin Sabet. Thank you very much. We appreciate your time.
Thanks, Drew.
Thank you.
All right, thank you.